Well, it's time for me to log in and register my COVID symptoms or my non-COVID symptoms for the day. So I'm going on my COVID symptom checker app here, and it invites me to take 1 minute each day to help fight the outbreak. And this is available in US versions and UK versions. So report today even if you're feeling well, because it's important, all this information, whether it's me yesterday, whether it's you have symptoms or whether you don't have symptoms, it's important to know. So have you had a test for COVID-19? No, I have not. So just next question. How do you feel physically right now? Well, I'm a little tired, but I feel physically normal. The alternative would be I'm not feeling quite well. Quite right, so which would presumably take you on to other options to register your COVID-19 symptoms. But I feel physically normal today, so I'll donk that one. Not reporting on behalf of someone else, so I'll skip that. I've already shared this app many times and I'm sharing it with you now. So thank you for your help and vital contribution to the study of COVID-19. Thank you for joining millions of people supporting scientists at King College London to help our health services. And that was it, because I'm feeling okay. Now, if I hadn't been feeling well, I'm not going to do it because I don't want to mess up the data, but it would give me various options to report my symptoms. And this means that epidemiological data can be collected from around the world, because the phone knows where I am and it now knows how I'm feeling, and it would know how I was feeling if I had COVID-19 symptoms. And the software on this will allow a pretty good adjudication of whether I had COVID-19 even without a test. So this means that this centralised data body can track the spread of the disease and the spread of symptoms around the world. So I would encourage you to download this app. I'll put a link for it in the description. I'm fairly happy. Well, I'm very happy. Well, obviously, I'm totally happy for myself that it's not representing any infringement of personal liberties or anything like that. It's just an anonymous data collecting app, as far as I know, and it is well approved by professional bodies in the UK, and I would assume the US as well. So I would encourage people to do that, because data is absolutely everything. We cannot fight an enemy we cannot see. At the moment, we're trying to fight an enemy which is largely invisible. And we don't have all the antibody testing we want, and we don't have all the antigen testing we want. So the clinical features that this app can give us is the next best thing. So I plan on doing this every day for the foreseeable future until this pandemic is over. So here we have the COVID symptom tracker app that I've just used, and it gives you information on how much COVID is in your area. Now, I don't live in the United States, but I believe it gives very similar data for the United States. So let's find out now. COVID in my area, and it seems to know where I live. So I live up, it's not on the map, it's around there, somewhere around Carlisle. Now, this is interesting. It tells me 341,075 people are currently predicted to have symptomatic COVID in the UK. And this age group presumably reflects those that have downloaded the app. And here we have a map that you can peruse through. So some areas don't have enough data, but most areas do. And this is the estimated percentage in various areas. So as we know, we see more in London. We see less in rural areas, but we're starting to see other hotspots emerge. And you can play with this once you've downloaded the app and get a lot more detail on any particular area that you are interested in. And then this gives us the predicted number of cases in millions. And we can see it's been dropping off very nicely because of the lockdown measures, the predicted number of cases. Problem I find with these things is that the data is so addictive that you can you kind of get a bit addicted. Now, other things here on the app, so helping those at risk. Lots of interesting information that I'll leave you to read through on your own. And this is new information on ACE inhibitors, which are anti-blood pressure drugs, and COVID-19, written by relevant experts in the field. So again, take your time and read through that. Now, this is about the research. So this is high quality research led by Dr. Tim Spector, Professor of Genetic Epidemiology at King's College London, and a well-known, prestigious academic. And then you can look at questions. Now, a lot of people have questions about this. I know a lot of you are concerned about apps, but who created the COVID symptom tracker? So you can learn that. This academic group with a spin-off company, but as far as I can see, there's no ads, so I don't think they're making any money on it. What is the aim of this research? Who will be using my data? How will my data be protected? And I think you'll be satisfied when you read that. How can I delete my data? So lots of questions there for people that are worried about it. But I believe this is a really useful research tool. So I'll leave you to peruse that on your own. But basically, we need data to fight this virus. We've got limited testing, but we do know the clinical characteristics of the virus. So a lot can be learned from your reporting of clinical characteristics. And as you've noticed, today I'm feeling fine. So I put that into the data. And that's important as well. It's all relevant data because we're tracking the health of the whole population at the moment. So as I've said, I intend to do this indefinitely. I've shared it on my Facebook and Twitter things, so I'm sharing it with you now, and I'll leave you to decide whether you want to contribute to this data. But versions for the UK and the United States at the moment, and I believe other countries will be coming online. And I think it's really important to make the invisible enemy more visible so we can attack in a more meaningful way.